So welcome everybody. We're going to do a sort of basic overview of basic EMT type skills, emergency life-saving skills. Charlie's going to run through the contents of this combat IFAC and this military issue trauma kit, talk about tourniquets, basic emergency life-saving, as well as sort of basic first aid and EMT type skills.
When we think about getting injured in a shit hits the fan scenario, it's big thing that you're going to worry about is infection. So that's where we're going to probably focus 99% of our attention, is that if you get infected and you don't have a way of addressing it with antibiotics or further care in the hospital, that could be what does you in. So we'll see what we got here for supplies. Bandage, good, that'll put some direct pressure. We'll do a couple things. If you do get wounded, I'll start with some talking points up here. Sure, no problem at all. If you do get wounded, let's say we'll draw a stick figure here. So this guy's wounded somewhere here. You've got 3 ways to stop bleeding. The mnemonic is DEPT. You've got direct pressure. Just put a little pressure on the wound depending on how deep it is, and if there's arteries involved, it might not work. But if you have a wound, mostly what you're going to have is venous wounds, direct pressure will work. You can combine that with a little elevation. Pressure point, if you've gotten this far and you still don't have any success, and the pressure points I'll talk about later on are basically right at the branches of where the major arteries are. And your tourniquet, which is in this kit, is going to be the last thing you're going to think of, because when you think of putting a tourniquet on, you're pretty much planning on losing that extremity. You're ceasing the flow further to save the core, but a tourniquet you would put above. Anything you're going to do to the wound as far as a tourniquet is put it above the wound. We think about the core and the distal, so you're going to put the tourniquet above the wound to stop the bleeding. So if you do get a wound, first thing you want to remember is that this much blood looks like this much more than this much blood. So some people have like a psychological response to a small amount of bleeding. A small amount of bleeding is your friend. It's going to take anything that got into this wound and push it out external of your body, and it's going to take any potential antigens or any kind of bacteria that are in that area, and it's the body's natural cleaning mechanism. So don't freak out if you see a wound with a moderate amount of blood. When you start getting into squirting bright red blood, now you're starting to talk about arterial bleeding. It's a much more serious situation. So you get a wound like that, if it's bleeding a little bit and it's venous, kind of let it bleed. Take your time. These are your basic bandages that I found here. Occlusive dressings we can get into in a minute. Compressed gauze. Gloves are good. Whenever you're handling anybody else, you don't know what you're exposing yourself to. And this is the rapid coagulation. So if you do have a large venous bleed, this is supposed to work really well. I don't have any first-hand experience with it, but it's supposed to work really well to speed up the clotting. These come in handy for lots of things, not just medicine, but if you need to cut anybody's clothes off, including leather jackets, anything like that, these will go right through them. So this is a chest seal. Something you want to remember about chest wounds is that they all suck. So anytime you get a chest wound, we'll draw a little bit more of a torso on this gentleman. Please don't mind the oddly proportioned head. If you get any wound in this general region here, it's going to have potential lung involvement. You got the 2 lungs here that branch out almost to the very edges of the chest. Your diaphragm is down here. When you go to inhale, your diaphragm goes south, and what that does is it just creates negative pressure in this space, and ideally air goes in here and fills your lungs the way it normally does, and then when you exhale, it goes out the same way. So if you have any wound in this region and you go to inhale by pulling down with this pressure here, you could potentially be bringing air through your anterior or posterior chest, wherever the wound is. So what you want to do is even a gloved hand, put it over the wound. What that does is it just seals it from the pressure. So when the air inhales, you can still inflate this lung. The lung starts out this big. It can get smaller, smaller, smaller until it's completely collapsed. At that point, it's not a very good prognosis for survival. But if you can get ahead of that by putting something over it like this occlusive chest seal, you'd be in better shape. The real way to simplify it here is air goes in and out. Blood goes round and round. Any variation is bad. So if you have air that's not going in and out and blood that's not going round and round, if you're losing blood, that's bad. So if you got an open chest wound, any open chest wound, slap that over the wound. What that does basically is it seals that area to the skin around the hole that's been made in you, and it prevents that outside air from getting put in. For more intensive care, like in a paramedic environment, we have needles to go in through, like you were saying, the second or third intercostal space right over here. Basically, you introduce a new path to relieve that air bleb that's in here. As soon as you release that, you can actually hear a hiss, and the air comes out to the environment, and then the lung reinflates. So you want to keep the lungs inflated.
So while you're opening that up, so at the point that you get to, you need a tourniquet, you have a chest wound, the lungs collapsing, whatever. If it's a situation where we don't have access to hospitals, I mean, this is just temporary.
Prognosis is not good. Yeah, prognosis is very bad. Most of the stuff we do is in the setting of bringing someone to further invasive care and the ability to get them on IV antibiotics if they have something that's been widely exposed to the environment. In some cases, you can stave off infection, and you could potentially lose a limb outside the hospital and still have a survivable outcome if you can stave off the infection, which we'll get into some of the infection stuff later on as far as peroxide and bleach and the uses for that. But it's not a very great outcome.
It's like the military training with these is just to stabilize you until they can
Field hospital.
Yeah.
Exactly. So if you don't have a field hospital and this is something that occurs like on your property and you don't have any place to go from there, I mean, it's not necessarily the best thing as far as a potential outcome. But if you know this stuff and there is a potential for some type of further care nearby, that could, like this stuff here is even beyond stuff that I've done as far as sutures goes. There's a suture kit in here, tweezers, what else do we got there? The simple things that could be also what gets you as far as like an ingrown toenail. Some people could not take care of that and have a massive infection. Normally they'd feel that pain and decide to go to the hospital, but if there's no hospital to go to, you have to know how to manage the infection. And a lot of the stuff I'm saying it comes with a lot of experience, but at the same time, my experience is always based on having that big fluffy hospital with all the professional staff there to help you out, and that can get you there in a quick amount of time. But if that's not there, I mean, really, it's a matter of considering what we have available and using what we have to the best of our knowledge. If someone's unconscious, this is an OPA. Basically, these go into their mouth, which protects them from choking on their own tongue. There's a whole, hundreds and hundreds of hours of classes that could be had just by going through all of it. So I'm just going to try and brush over it. You've got a lot of stuff to do: dressings, eye wash. This is a really good kit. How much was this kit?
$140 on Amazon.
Wow.
It's called the Military Level 3 Field Trauma Bag or something like that.
It's got Calamine lotion?
It's got Calamine lotion. And in case, it's got the first aid guide. Yep. CPR, even with a hospital, is generally futile. In traumatic arrest cases, it's less than 5% of people that get saved. Even in the city, if someone goes down and it's traumatic, is their cause of arrest, the person that can save them is a surgeon, generally speaking. Not to say that we shouldn't try, but given some of these circumstances that we're talking about, it could be a matter of just actually dealing with mortality.
Would you recommend an AED for the field, or if something's that bad, do you think that would just be a waste of carrying something?
It's somewhat of a waste. There are a small percentage of cases where someone could go into cardiac arrest and that could bring them back into a rhythm, but they will need a lot of care. They're going to need an ICU at that point. And if you don't have that care to give them, you don't have the ICU, you're going to get their heart beating. But you know, there's a reason that their heart stopped beating in the first place.
Yeah.
And if you can't address that cause, then you're going to have a problem. Can't say enough about sterility and clean dressings. So if you do have any wounds that end up occurring, even if it's something simple like you skinned your elbow, keeping things clean and keeping them debrided out with some hydrogen peroxide and dry dressings, the whole game starts the minute it happens. If you can get it to bleed, like if you have a superficial wound, you can encourage bleeding by lowering it and kind of milking the tissue. You want to do that and let it bleed. There's certain cases, some people are on anticoagulants like Coumadin or blood thinners for certain medical conditions. Those people they're going to have a different situation to handle because their bleeding mechanism, their clotting mechanisms may not kick in fully.
So like in a normal situation right now, you know, your kid's out on he falls down on his bike, he comes in, he's all scraped up, we're breaking out the Solarcaine or whatever the first aid spray is, you know, we clean it, blood, we put a bandage on there. What is the best way, like in sort of this post, you know, shit hit the fan type scenario, treating those minor cuts and things so they don't become serious? What is the best type of cleaning or ointment or antibiotic or antiseptic or whatever?
You want to actually, one good thing that's a great antiseptic, it might sound gross, but urine.
Yep.
The pecking order, I would say the first thing you have to your advantage is your own blood. As long as you're not down hypovolemic for some reason, if you can bleed through that opening, whatever caused that is going to introduce bacteria into your body. So your first thing that you want to do is get that bacteria out, and there's no better mechanism than what's coming out as it happens, which is your own blood. And your own blood's going to push out. A lot of people are afraid of a small amount of bleeding, and it's not necessarily warranted fear. If I got an abrasion right here, the first thing I would want to do is to kind of get it to bleed, and I want to push it out before I started introducing anything from the exterior in to clean it. I would want to let everything that got in kind of push itself out directly from the blood. Then you take peroxide, run it under peroxide, take sterile dressings, debride it, get anything that's in there. If you have any, depending on what caused it, you could have any type of, what's the word I'm looking for? It's like particulate or sand or any kind of, you know, could be from wood, could be splinters, could be anything else. You want to get everything you can out of it. And then you start cleaning it, and you want to keep it nice with dry dressings. These are really good to have, multi-trauma dressings. These come with direct pressure. Just first thing you do, right over the wound, put a ton of pressure on it with your hand. These can be used to set up a pressure dressing. So you could set that up on the skin and then wrap it tightly with this. If you have any doubts as to whether or not it's too tight, check your pulses. The best way to look at it is downstream and upstream. So if your heart's here, if you have a wound here, you want to check this limb for pulses in the hand. So if you put a dressing on and you want to know if it's too tight, if you can't feel a pulse here, then that dressing's too tight. You want to back that dressing off just a little bit, provided the bleeding's controlled. So it's kind of like you're pushing as far as it'll allow you. But if you put this too tight and you're not getting any type of distal pulses here, then you want to back that off a little bit. Triangle bandages, these are great. You can make slings. You can do sling and swaths with these.
So if you have a pretty good cut and you get the bleeding sort of under control, like the Durobond stuff and that kind of stuff, when would you seal it up?
When you're fairly certain it's clean, like I'd say within 10-15 minutes of the wound actually expectorating all the blood and the things that are in the wound out of it, and you've cleaned it now with a bunch of hydrogen peroxide. You can dress it with antibiotic cream like Neosporin. They make a Neosporin now that has pain relief in it. It works amazing. Something that would normally sting you for hours, you put a little of this stuff on, and it's a local antibiotic, and you can dress it with that. But if after you dress it, you just want to check in on it and make sure that it's still it still looks good hours later. You know, if you have anything that smells coming out of it, anything that doesn't look right and it's green, things like that are signs of infection, it means you want to go in and maybe debride it even a little bit more. You know, so if you had like a scab or something like here and it was starting to show signs of an infection, even though at this point it hurts more than it did when you first got it, you'd still want to go after it with the peroxide, and you'd want to go after it with anything.
Actually pull the scab off to make it bleed
If you
again.
had to, anything clean and sterile, as long as you're visualizing that you're only putting something clean and sterile against it, and you keep hitting it with peroxide, those wounds would benefit from that. Absolutely.
Do you know if there's a shelf life on hydrogen peroxide?
I'm not 100%. I think there's a shelf life on everything,
You
but
gotta keep it out of direct sunlight. That's why most hydrogen peroxide
brown.
comes in that brown bottle.
yeah.
So I imagine certain wounds won't close, so the needle and thread might be pretty handy, right?
Yeah, and this kit actually has a suture kit. That might be Durabond. People use crazy glue. If you can get the skin to close, steri strips, crazy glue, things of that nature. I'm not sure if it's wide open, if I would want cyanacrylate inside the actual vessels themselves, but if it was something where it just wouldn't close and I could hold it together and get somebody to glue it, I mean, it dries pretty quick.
Super glue was actually invented for the medical field. It was just a byproduct that it got into industrial, but it's the same thing. They actually developed in the 60s a quick wound closure system.
So to answer your question, it says here that 3% hydrogen peroxide after a year in brown bottle will be 1%.
Huh.
After 1 year, really?
Yeah.
Wow. I know with bleach, if you mix a bleach solution, if it doesn't have a smell to it, it's no good, and if it's exposed to air after 2 or 3 days, it's generally no good. But if you made it like a spray bottle, it could last, you know, up to a month, provided it's not exposed to air. Ice packs, I think everybody knows what those are for, and just to reduce swelling. Generally, if you have a musculoskeletal injury, it's rest ice, compression, elevation, which will assist the healing. Q-tips are good. It looks like you got lots of dressings. Big box of Band-Aids.
How often should you be changing dressings? Like if you get one of those wounds where, you know, you want to try to stave off infection.
Right.
You let it coagulate, you clean it, Neosporin or some kind of, you know, antiseptic or whatever, and you wrap it up. How often should you be changing that bandage? Like, is there a rule of thumb? Or?
I'd weigh your needs against your supplies. If you can afford to, 2 or 3 times a day. If you know you have enough supplies and you're not that worried about it. But if you were in the woods and all you had was this, I would say at least once a day.
What about improvised dressings? Is there a way, like I heard, feminine pads?
Well, they're actually here, ABD pads. They call them ABD pads. And they're super absorbent. This is hemorrhage control bandage. I believe it's just a
That is an Israeli
pressure.
bandage in its vacuum form. I've got one that I'll demonstrate here in the Ziploc bag.
Can you talk a few minutes about tourniquets?
Sure, absolutely.
About
Tourniquets.
Some of the best ways, and you know, using stuff where you don't have a tourniquet kit with you, but you may have to
A
use
belt, a shoelace, anything that you can apply 360 degrees of pressure is going to be your tourniquet. These, if you're in a good place and you have combat action tourniquets, these are the best way to do it because you can essentially apply them with one hand once you wrap it around. The biggest indication that you're going to need a tourniquet is a spray. So if you have a wound that happens to coincide with the heart beating, a squirt of blood coming out of that wound, then that's a wound that's going to kill you in a very, very short amount of time. You've only got so much volume in you, and every pump is losing your volume. It's basically like if you poke a hole in a balloon or anything else as far as a principle goes. Tourniquets, generally, if I had an arterial wound here, I would like a tourniquet to be somewhat close to that wound so that I don't lose everything up here. But if for some reason that's not working, you can do more than one tourniquet on one limb, or you can put a tourniquet closer to the pressure points. So the pressure points are going to be high femoral or brachial, right in this area here. But once you put that on, generally we write right on it or right on the patient's forehead. Like, what are we at here? 2130. So that's the clock that starts from when the tourniquet got placed. That's in the mindset of taking it somewhere where there's a surgeon and they know that, you know, that's their tissue death that they're dealing with is from 2130. If it's just I need to survive, sometimes you need to make peace with the fact that that's not a real scenario, and then that limb could be lost and the person may actually expire from that wound. But tourniquets, definitely the last ditch, last case scenario. The direct pressure to the wound that'll stop most wounds with venous bleeding. I mean, when you're talking about gunshots and you start talking about blast issues and serious trauma, then sometimes direct pressure won't work. If it is arterial, you can direct pressure and elevation. I've seen actually stop an arterial bleed, but it's generally a lot of elevation and a lot of pressure. Like I said before, checking to see that the person still has a distal pulse. If you can't feel a distal pulse, generally if you just blanch, like if you look at your fingernails or your thumbnails, if you put a little pressure on there, it turns white. If you let go, it turns pink again. That pink is capillary refill. So if you have a wound that's not refilling on a capillary level, or it's taking a really long time to refill, then your circulation is compromised, and you either need to decrease how hard the tourniquet is on, or the pressure dressing is on. But once it's to a tourniquet, actually, you've cut off that possibility. So the important thing is to remember that tourniquets are last ditch.
And Charlie, I've only seen one radial artery wound, but I mean the thing pulled back inside too. I mean the thing kind of took off up into the arm a little bit. It seemed like it retracted.
So you can still technically bleed out. If it was spraying here and it retracted, it could be spraying in your forearm, and you could end up with what we call a compartment syndrome, where you have so much pressure around the vessels where the venous return is happening that the venous return is not happening anymore. So if you had, let's say you ran over my arm with your truck for some reason, you know, now there's a lot of crush issue and trauma here. I could have arteries severed, and the artery severed would be bleeding out in a place with no place for the blood to go, and that every time the heart pumps increases the pressure, and it's never good. No, it creates a compartment syndrome. I mean, shock is generally what kills us, and if we look at the body as a container of fluid, you've got your head, this guy's laying down. So you need a certain amount of blood pressure to perfuse your head. Anybody ever seen somebody just pass out at the sight of blood, or pass out because they found out some really bad news? It's basically a protective mechanism in the body. It's called psychogenic shock. Everything kind of relaxes at once, and because you need this much pressure, 70 systolic roughly to perfuse the head with somebody that's standing, the blood kind of just goes loose. As the body as a container it loses what we call a sympathetic tone. Your nervous system's a parasympathetic and the sympathetic. You lose your sympathetic tone. The person passes out, falls down. It's a self-correcting problem. The heart rate kicks up to adjust for the blood pressure loss, and then they wake up and say, what happened? Well, if you lose blood from a wound, the same type of thing is possible, where the brain's not being perfused and the organs aren't being perfused. So you can lay somebody flat. Another step you can take, and that's not what you think it is. We'll put a foot on there. These are the feet. They're no longer laid out. Now you've elevated the feet. You could put like a suitcase, or you put your handy med bag under the feet. Now you're getting more blood to the head. It's a prolonging mechanism, but it's not necessarily going to make for a good outcome if you've gotten that far. But if someone just passes out or someone loses that much blood, you can get them like this, and the blood's going to go back to their core and their brain, so that they're going to perfuse what they need to perfuse to stay alive.
And then get the intel.
You could buy them time, exactly. If you could buy them time, exactly. As far as stuff to keep things sterile, I would recommend getting a ton of bleach, and you don't need a lot of bleach when you're mixing a bleach solution. One part per 10. So 10% solution of bleach is all you need. That's all we use in the ambulance to kill. It'll kill literally every bug under the sun. You spray things down with the bleach. You let it sit. You should smell a strong odor from the bleach. If you don't smell the odor from the bleach, then that bleach needs to be changed out. You wipe the surface down, and now it's essentially sterile. Now, there's nothing that can live in that. It's not certified sterile, but there's nothing that can live in that. I wouldn't recommend putting the bleach directly on you. But if you're using anything and you need to, you know, if you had a kit like this and you were in a situation where you needed it, you may not be able to replace something. So if you, say, use the tourniquet on somebody and they didn't have a good outcome, you're not just going to leave the tourniquet. You're going to take it, now it's covered with their blood. You're going to have to sterilize it. And just a 10% bleach solution will do that.
And for anybody that wasn't at our food and water class, if you can buy the 70 to 80% pool shock from a pool store, generally Walmart places don't have the stronger. You can look; those are usually like 50%. You get the 70 to 80%. It's indefinite long-term storage. The bleach only lasts 6 months to a year, and the pool shock is indefinite. And 1 pound shock, a 1 pound pool shock will disinfect 10,000 gallons.
Also remember, add the shock to the water, not the water to
Yes.
the shock.
Yes. So the
Unless you want to see a
reaction.
really nice, you know, pyrotechnic display, add cool shock.
And wear goggles and gloves and carefully mix it.
And when we talk about a lot of this stuff, the interesting thing is to think about what are you going to carry? Like what's going to, you guys were talking about maybe meeting up if the shit ever did hit the fan. And realistically, I look at my house and like what I have ready to go and what I have in storage, and I wouldn't want to leave what I have in storage, even though I know I'm a sitting duck and an obvious target.
Not that this fits in everybody's budget. This was one of my things I bought in the last year or so. You know, it was a sort of the monthly purchase, but roughly $140. Do you see anything that's really that you think's lacking in this kit?
Nothing that you couldn't make. Like if you needed to make a splint, like if you had a fracture of a limb, you have the things that you could use.
Yeah.
But there's no actual splints.
Yeah.
There is a suture kit. The only other thing I would think of adding is a SAM splint. Because SAM splints, you can get the extra large SAM splints. And then what do we do with the shears? There's some shears here. The shears can cut through the SAM splint, and you can make a finger splint. You can make a splint for your whole forearm. If you get the extra large SAM splints, there's really nothing you can't do with them. If you have an ankle fracture, you could take 2 SAM splints and make an L&U. Just basically goes up the side and around the back, wrap the whole thing up, and now you're essentially in a homemade cast. So if I had anything to add to this, I would say a couple of extra large SAM splints.
Those are pretty cheap.
Yeah, really cheap. Really, I mean, even aside from medical, when you look at these things and how strong and pliable they are and how rigid they stay, there's a lot of things that you could find a use for with them.
What I wanted to do real quick, I guess. So Charlie, that was awesome, man. I don't know, anybody have any specific questions for Charlie?
Thanks, guys. Appreciate it.
You can stay here or have a seat or whatever,
Sure.
but I was going to start a list maybe, and again, this is kind of for to have on the video, but let's make a list of stuff for people to buy. Sterile bandages. Gauze. Band-aids. Like Ace bandages, right? Coban.
COBAN?
COBAN.
That's the medical stuff. I think they call it self-adherent latex bandage.
So similar to Ace bandage.
That's where it's from.
We had
Peroxide, bleach, ability to make bleach, right?
Peroxide.
Neosporin.
Yeah, that was right. Neosporin.
That's a good stuff to stock.
Hand sanitizer and gloves. Benadryl.
Absolutely.
Don't forget Imodium.
And
Key. If you lose your volume, you're not getting it back.
If
Imodium
you get a case of the squirts and out in the, you're,
and dysentery
you're
in
in
the field
trouble.
is very powerful. Yeah.
Naturally way to lose weight.
That's something I
You
would
can drink as
absolutely
much
add.
water
That's
as you
a
want, but
great
if
thing.
it's just coming right out,
You'll pass out every time you stand up,
Gloves.
and you won't
I've
be able
had
to.
that before in Mexico.
Yeah.
some way to do suture?
It's not fun.
No, dude, it was terrible, seriously, I was, what I was eating was just.
Chad, why
I
don't you
think
move to that
another word
second
for it,
list
they
there?
call it Montezuma's Revenge.
Yeah.
Move to that second list there, if you could.
Okay. Gloves and N95 mask. We mentioned the N95
Yeah, we didn't really,
mask.
I didn't touch on the N95 masks, but they're relatively cheap and they filter out almost everything that's in the air. So if you end up in a situation where there are bodies around, you're not going to want to breathe the stuff that's coming off of a body that's
Luckily
been there
enough, my
for a
wife
month.
used to work in
Is that a
lab, so we got one.
No, it's the, you know the TB masks? It's just basically a paper mask. It filters like 99.9%.
Okay.
3M, I think they marketed it as a painting mask. Yep.
Real quick,
Yep.
actually, you can actually get a little bottle of raw honey, not the stuff that comes in a little teddy bear,
Right,
but actual raw honey. It has a lot of great uses for it. For one thing, it's
bacterial
it's
static.
antibacterial, antiviral. Let's put it this way: if you start a regimen of raw honey, you can actually get rid of ulcers if you have ulcers.
And allergies too.
Allergies as well, yeah.
It's local.
So you need some way to close wounds that are very large, so like the glue, the Durobond type idea, or suture, some way to do suture?
What about
Well,
us?
you get the guys any kind of size that you need.
Right.
So, it's just a matter of
Glucagon?
getting
The stuff that you take oral hypoglycemic, the oral gel.
Calamine.
That's oral glucose. Glucagon is actually it's an intramuscular injection.
Actually, you
Oh,
can
So it releases the
that's actually a
glycogen
lot
stores in
cheaper
the
than
liver,
Calamine.
but it's
What's that?
generally
Apple cider vinegar.
I heard about that. What were you just talking about?
Diabetics are
It works
Poison
for
ivy.
me.
whole other
It worked for
Yeah.
me.
thing. You know what I mean?
Yeah.
But if you have
I was shocked.
if you
Within
have someone
15
with you
minutes,
diabetic, it'd be
done.
important.
Yeah, dude,
Did you do the paper bag?
Yes, I did.
So
Does it get
apple
the
cider
itch?
vinegar
What you
in
do is you
paper
take-
bag strips.
If you ever contract poison ivy,
Yep.
what you take is cut a brown paper bag into strips, put it in a bowl, and just let it soak in apple cider vinegar. Once it's really nice and soaked, put it in the affected area. Within about 15 minutes, it starts the reaction between the apple cider vinegar and the brown paper bag actually starts drawing out the poison from the poison ivy in your skin, and it'll actually get rid of the itch. I actually contracted poison ivy on the top of my foot. For the longest time, I thought it was an allergy, but then when I really looked at it, poison ivy. I did that for 15 minutes.
That's your ace bandage. Yeah.
Once I took it off, no longer
That's a
itch.
good size one too. You could
It's
do
also
it.
good for reflux.
Yes, it is.
Also, the stuff that's on a poison ivy plant is it's basically an oil, and they say if you can get it off of you within like 2 to 6 hours, because it slowly basically burns the skin. If you can, and the best way to get it off, I just recently watched a video from a guy. It's friction. He said just use soap and water with a washcloth, and make sure you hit the areas like between the fingers and down, because that's where, like, I've always get poison ivy on my elbows because the water runs down after I wash, and that oil will sit back there. So
Dawn
Dawn, yeah, that's
dishwashing
what I
liquid
heard.
is like really
yeah,
good
it's
for
a
that.
deep
Watch me right.
It's
Just
So-
do the thing.
Yeah.
I or E?
I. And the other one's an I also.
Believe it or not, nature provides
This
a lot of
No,
remedies.
no, it's E. It's E. You sure?
And the itch with the poison ivy, it's a histamine response. If you can get hot water, if you have access to hot water, put it under hot water as you can.
You're not gonna
stand.
lose any
Don't burn
points,
yourself.
Jeff, don't worry about
It releases all the histamines, so the itch goes away. It's almost like if you run it under hot water under the sink and then take it out, put it back, take it out 2 or 3 times, it won't itch. Even if it's been driving you nuts for like 3 or 4 hours.
There's a special soap too that they sell. You can get it at Walmart. It looks like a 1940s soap.
Okay.
It's a real lye soap.
Yeah.
Most soap they sell today is actually detergent, so if you look at the ingredients on the soap and it doesn't have the word lye in it, L-Y-E, it's not a real soap. So, just because it's caustic and it takes 4 to 6 weeks for a bar to harden, the companies are lazy to use a cheaper type of formula. So any of those old-time lye soap bars, which you can usually find them in any kind of hardware store or general store.
Doesn't Ivory have lye in it, I believe?
I don't think any of the major soap companies have it in there, as far as I know. It's just because lye is very caustic. It's one of the ingredients in the pool shock, actually. So when you make the soap, you're actually heating it up to a process of about 180 degrees by just mixing it together for chemical reaction. So it's kind of nasty stuff, and I would imagine on industrial steel that would make a really good explosion.
One thing to know, you guys probably already know on the Benadryl, is that it's going to put you to sleep. That's what's in every over-the-counter sleeping pill for the most part. It's basically Benadryl. So
What's that other stuff that, the non-drowsy stuff?
for
Well, some of it's caffeine-based, the no-goes and stuff like that.
Antihistamine, no.
Allegra or something like that.
Something like that, yeah.
Yeah.
I think it actually begins with an N, I don't remember. Like a 24-hour pill, you just take one, it's like 24 hours.
If you can find something, anything besides Benadryl, that would be it.
Naproxen is a non-steroidal.
Benadryl works really well, but its side effect is definitely puts you
I
to
mean,
sleep.
don't forget too, I mean, if you just walk up and down the aisles in CVS, I mean, cold medicine, cough medicine, I mean, all that stuff is, I mean, might as well be in the same kind of area, because, I mean, that's the,
Any long term,
Yeah.
you're gonna wanna stock up on any of that type of stuff.
yep.
So what about some kind of like, if you can't get antibiotics, what about silver as
You
an
can get
antibiotic?
antibiotics, you can buy fish antibiotics.
I mean, what if you can't buy anything? What about silver as an antibiotic?
Yeah, colloidal silver.
Colloidal silver.
Don't forget, the antibiotics do have a shelf life.
Yeah, they sell straight bottles of
It's
that.
gotta be
It's supposed to be
99.9.
You
amazing.
get the colloidal silver from CVS, it's gonna
Yeah,
cost
with
you
Ratrol
like for a bottle.
Yep.
It's literally gonna be like 10 or 12 bucks for a small bottle, it's an ounce.
Any idea on the
there-
shelf life?
How long
Was there schools of thoughts on whether the fish antibiotics or that is more
Probably a year or
effective?
two, I guess, I don't know.
You know what, if you give me your contact information,
Yeah.
my wife actually has, because she used to work in a medical lab, she actually has a book that pretty much names every pharmaceutical out there,
Yeah.
and it actually mentions a lot of animal antibiotics.
No, but I mean, like, if you have a choice between, you know, going that route or like the colloidal silver, is one better than the other, or?
Well, colloidal silver is a topical, so you're gonna use that just like you would a Neosporin or something else like that.
Oh,
It's in
okay,
a gel.
okay, got it.
So,
You got somebody
Not
that's
gonna ingest silver.
highly allergic to stings, like bee
Not
stings,
right.
you might wanna carry
I'll just take my
EpiPens.
silver coins and lay it on.
Or if you can get your hands on Epi 1-to-1000. The reason it's an EpiPen is because of accidental overdoses that have happened in the field. An EpiPen costs about $200, but for about $3 you can get 50 EpiPens worth. Like, if you overdose, that's the problem. So you just draw up 0.3 milligrams
Be careful, yeah.
into a syringe.
Those pens have a short,
If you had somebody that had a really bad reaction, and you were talking about prepping where you wouldn't have access to EpiPens, I would definitely say see if you can get Epi 1-to-1000 high dose.
That's interesting.
But
I've got one that is allergic, so I've gotta keep on those around.
it's basically like a tuberculin needle, like the diabetic needle for insulin. It's a very shallow injection, and it's 0.3 milligrams, and it's essentially exactly what's in the EpiPen. It's just there's a risk of somebody in the field giving it through the wrong route or giving too much of it, and then it could have side effects.
So I just want to give you a quick class on how to use one of these tourniquets. Unfortunately, I don't have too many, so if you guys would just pass that around and kind of share it in each group. Basically, this was developed in the Army in about 2003 because they were still making tourniquets from an old rag and using a stick, and that kind of medical baloney hopefully went away finally. Basically, these are a big constriction band with a hand crank on it. So to use this, first you would take it open, and depending on what limb you're going to use is how you're going to use the buckle here for the Velcro. If you're going to use it on an arm, you're just going to use the single buckle. And you just literally run this through and back over itself. But if you're going to use it for a leg where you need much more tension, you're actually going to run it through both of the buckles in order to get maximum tension on it. Okay? No, this all comes in one size. And it just basically Velcros to itself. So I'm just going to do this on my leg here, which hopefully the camera...
Could we actually have like a volunteer come up real?
Yeah. I promise I won't crank this down on you.
A little easier for the video.
All right.
Anyways,
We'll just mark the time on
So
the
since-
forehead.
Check the cap refill.
He's got the Sharpie.
All right. We got you in frame? We good? Okay.
and then we'll go off the
All right. So we're doing an arm. So we're just going to do one single buckle. We're just going to pretend the wound is right here. We're going to try and get this as close as possible to that wound. Wrap this around tightly. Okay. Not going to make it too tight here. Your next course of action
is to unstrap this piece of Velcro here and begin twisting this mechanism. You're going to twist this as much as you can, as tight as you can, and then when you're finally done, you're going to lock it into this plastic holder. And then you're going to close this to make sure it doesn't come out again. Okay? Really that simple. Problem is that these are only built for one use, so you're pretty much screwed after you use it because they believe that the tension is just too much on it. Once it's stretched out enough, it can't be used again. I'm not saying that it can't be used again. I don't know. There could be just a nice medical supply company saying, hey, you can only use the product once, order again, haha. But who knows? Once you're done with this, this is actually an older version. The newer ones, this is actually a white band that says time on it. So instead of writing on the patient's forehead what time the tourniquet and date was applied, you could actually just write it here. I personally would put it on the forehead because I'd be more inclined to look at their forehead first to see what their vitals were before starting to fool around with anything else. So,
might be another thing to add to that.
yes, I would definitely have a Sharpie in your first aid kit anyways, just because you need to mark points.
And the IFACs too, I mean that's...
Exactly,
right.
Yep.
Something that's not in there.
When you buy these, some of the newer ones will have a color code for orange on here just to show you where the end of the strip is, because when it's folded up onto itself, sometimes the black melts into each other. Since these are older ones, I just literally took a paint pen, did a little retro myself, did the same with this piece too, so you know which side is open on it. If you guys just want to keep passing those around, and if you want to practice on them, feel free to do that. And we can stay late and work on it if you want to do that as well. Yeah, I would not recommend the neckline tourniquet unless you really hate that relative. So the next thing I want to cover is a pressure bandage, the Israeli bandage. This is what they look like when they're still sealed in the kit. They're going to come vacuum sealed. What I would recommend doing is definitely get these, the vacuum sealed ones, online, make sure they're nice and sterile. But if you go to your local Army Navy store, they might have one that isn't sterile anymore for a couple of bucks. I managed to find a 6-inch one for $2 at my local Army Navy store because it was all bloated, definitely not sterile anymore. I talked the guy down and got the bandage for nothing. Now I have something to practice with. No matter what the size is on these, whether they're 4, 6, or chest, they're all designed the same way. And basically, this has a bandage on the inside, a restriction band, and then a locking bar, which is actually rolled up in here. And it will come somewhat in an arrangement like this. You'll open this up, stretch it out. If you're going to put this, can I grab you again, please? This is your bandage side. What you're going to do is wrap around. Then if you notice this locking bar here, oops, it has a small hole inside of it in the middle. What you want to do is come through that by twisting, getting the bandage flat inside the locking bar, and then pulling it tight over the top of the wound. Now, this locking bar should go right over the top of the wound in order to provide the most pressure possible. And as I'm sure you can complain, the more you wrap on this, the more pressure is going to be applied. And then eventually you come to the end and you'll have this plastic bar here. What's really neat about this design is it's designed for you to tuck it in on both sides, and this locks the dressing into itself. I'm not going to do it real tight because it's a pain to get off. But basically that locks the whole thing together and it's not going to come off. So this is called an Israeli bandage. It was developed by an Israeli medic in the late 90s, early 2000s. The Army decided they were going to try it out. They loved it so much, they started buying millions of them. You'll be able to find these on Amazon, just about any place that sells medical supplies. They're not cheap. One of these 6-inch bandages was about 16 bucks. But on the other hand, this is a real trauma dressing built by a real field medic. And if you follow world politics at all, you'll know that the Israelis have been in combat since the day their nation was created, so they don't screw around with this battlefield medicine stuff. This isn't something that's all done in the laboratory and they test a few years later. This is stuff that's constantly evolving and being used. Now, when you open one of these, it's actually sealed twice. There's this outer bag, and I'll pass this around. This actually has directions on it to show you how to use it, but there's actually a bag inside that seals this all in a clear format. You don't necessarily need to keep the outside bag, but on the other hand, you can actually use any plastic bag as an occlusive device. So if you need a chest seal in a pinch, you can actually do that with some duct tape and and hopefully one of these. That's, you know, if possible, but that might be something you want to think about. I don't know if any of you have gone to an Army Navy store and you've seen, oh, Special Forces Medical Handbook from 1962. Don't waste your money on that. This is the latest and greatest thing from the special operations community. This is only available through the government printing office, but anybody can buy it. Unfortunately, it's $60, but if you had a nurse or a doctor in your particular community and they needed something to figure out how to deal with anything from a lump in someone's breast to doing minor surgery, this is the book that's going to tell them to do that. So this is also available in an EPUB for about $10, I believe, or a disc for slightly more, but I would probably want to have the printed out one just in case everything goes to hell and you're not flipping between pages in the middle of something. Also inside of this book, they talk a lot about field sanitation, how to set up latrines and where to put them, making sure that you're not cross-contaminating your food sources and doing all the right things there to make sure that your camp is set up correctly so things don't cross-contaminate each other. Because a lot of these special forces guys, when they go into a foreign country, their primary job is to teach the indigenous people on how to resist a tyrannical government. So they're teaching them to not only fight that government, but they're also teaching them basic medical techniques and other things to keep them sustained during that fight. Also, their peacetime mission is to do a lot of medical trips to go into other third world countries and do basic care to a lot of the outlying villages and things. And most of these special forces guys that are medical technicians, they're almost board certified doctors. That's how intense their training is. So most of them, they come out, they do another couple of 100 hours and they get their actual medical certificate from a lot of the colleges that they go to. So they have a huge amount of knowledge of just everything from all sorts of different illnesses and things like that. So, oh, last but not least, if you have one of those IFAC kits, I highly recommend that if you're going to put it on your gear, that you have a rip-away system for it, because you're probably not going to be able to reach across this bag or get to your gear and get that bag off. So you're going to want something that retrofits it, where you can basically tear this guy off and use the whole kit if you need it. Maxpedition makes this kit. They're the only ones that I see that do it. Basically, it's a set of Velcro panels that lash onto your molly, where you put this restriction band in the middle, and that keeps your kit from falling off. So, do they? Yeah, Maxpedition is the only one I've seen, but once I bought the panels, I never bothered to go look for them again. Everybody I talked to that's still in the service said if you got to have a rip-away kit, because you may have an injury on one side or the other and you just can't reach across. You need to tear the whole thing off and just basically unzip the bag and dump it out.
So you pop that buckle and just rip.
Right, yeah. What I do is I keep the buckle tensioned on it just so it's tight.
Yeah.
So if I need to, I can do it with 2 fingers and it pops right off. And then you can just tear the kit off.
That's awesome.
So, and this can be retrofitted to any old standard bag that just has the regular molly on the back. But also, I would recommend if you have multiple pouches that look the same, because I actually have a pouch on the other side that's also stamen and gear, I would use your red paracord and use or get rid of rather the drawstrings and replace them with this, because red's kind of the international color for first aid. You know, that may be covered up by this particular band. Of course, A positive, somebody might assume it's a medical pack, but just having that red on there is a kind of a good guarantee for that type of thing. So